Hello, everybody. My name is Dr. Stephen Stokes. Today we're talking about cholesterol. And I think cholesterol's role in health and longevity is very important, but unfortunately, it's really misunderstood by most people. And I want to start this video by telling you right now that the decisions you make concerning cholesterol could have fatal consequences. Fatal consequences, people. So it's important. It matters, and it matters a lot. But look, I get it. I watch all those YouTube videos, as you do, and I hear some people, some of them who seem sincere, and they say things like cholesterol doesn't matter or high cholesterol is okay, and that it doesn't cause heart disease or it doesn't cause stroke. I mean, I watched one video where the presenter said cholesterol numbers as high as 400 or 500 are okay, and you don't need to worry. In fact, he said these higher cholesterol numbers equate to a healthier person. Specifically, he said a much higher sex drive. Wow. I mean, I have to admit, it's all very entertaining and influential. I mean, who doesn't want all that, right? I mean, I know I do. So, because I'm a nerd, I went back and I decided to restudy cholesterol because I thought I may have missed something, but more on that later. So for right now, let's just defocus on the controversy. Instead, let's have a clinical discussion. I mean, that's what I understand, right? That's what I have experience with. I'm a clinician and I'm not a scientist. So all my experience and opinions are based on what I see happen to my patients. And sometimes, because even myself, like I'm also my own patient, although that sounds a bit weird. But yeah, that's what I have to offer you, and that's what I'm bringing to the video today. This is a cholesterol deep dive. Plus, as an added bonus, I'm going to include my own blood results that I got from testing out some of these theories, and the results are very surprising. So, if you've been told that you have high cholesterol, or if you think that maybe you should take a statin medicine, or maybe you're taking a statin medicine, or perhaps you're interested in preventing heart disease, stroke, then this is going to be the video that I made for you. If you're somebody who has none of those problems, but you're just interested in longevity and health, again, this is your video. Okay, so let's start off by discussing why it is that cholesterol matters. And what is cholesterol, right? So cholesterol is this waxy fat-like substance and is found in every cell of the body. And it's crucial for building cell membranes. It produces certain hormones like cortisol and estrogen, testosterone, and it even is involved in the production of less popular hormones like vitamin D. Also, it may surprise you to learn that cholesterol has a pivotal role in bile production, and that helps us digest fats, which is kind of interesting, right? To think that cholesterol, a fat or fatty substance, actually is used to help us digest fats. So that's kind of an interesting correlation, right? Now something else that I need you to understand is that our bodies produce cholesterol naturally. I mean, yes, it's found in certain foods like that double cheeseburger you had for lunch, but we actually get very little cholesterol from dietary sources. We make most of the cholesterol we need. It comes from our liver and not from our diet. Look, if you eat only 200 to 300 milligrams of cholesterol a day, and one egg yolk, I think, is about 200 milligrams, then your liver is going to produce an additional 800 milligrams a day from raw materials such as fats, sugars, and proteins to make up that difference. And that should really tell you something about how important cholesterol is when we know that the body produces it naturally. But look, since cholesterol is a fat, it can't travel alone in the bloodstream because it just end up as these useless globs, right? Imagine bacon fat floating in a pot of water, right? To get around this problem, the body packages the cholesterol into protein-covered particles that mix easily with the blood. And these tiny particles are called lipoproteins, which is a lipid plus a protein. So lipoprotein or lipoprotein. So these lipid proteins or lipoproteins, they move cholesterol throughout the body. And the ones that transport the cholesterol from the liver to the body are called low-density lipoproteins, LDLs, and the carriers that transport the cholesterol from the body back to the liver are called high-density lipoproteins, HDLs. And most of us are familiar with these two terms, LDLs and HDLs. But just realize that they're not different cholesterols, same cholesterol, just different packaging that the cholesterol is transported in. So, like I mentioned, most of our cholesterol is made in the liver and it's used for many body functions. But I think the most useful purpose of cholesterol is its role in helping repair the linings of our blood vessels. And by the way, this lining in our blood vessels, it's almost like a Teflon coating. That's really the best way to picture it. And yes, cholesterol actually helps to heal and repair that lining. So let's go deeper here, because this is where really the misinformation about cholesterol starts. And we can start by looking at how the body responds to a vascular injury. I think that's really going to show you through an example how all this sort of comes into play. So first, you need to know that your blood vessels, they have this, like I mentioned, this Teflon coating on their surface. And this allows fluids to glide effortlessly through the vascular system. But this surface can get disrupted by some very specific events. And I want you to pay close attention to these, because essentially what I'm going to give you is the cause of heart disease, stroke, and atherosclerosis, right? Okay, so no surprise that smoking and drinking are top contenders. So let's just say stop that. Just stop that right away. And there's a push to suggest that moderate alcohol may be okay, but it's not. And the next thing that we have to contend with is sugar, right? Eating too much sugar, it's another big one. We'll tackle that when we talk about diet in just a minute. But if you're diabetic or if you have blood sugar challenges, then you already know that higher risk for cardiovascular diseases occur in people who are diabetic. And that's because the sugar injures the blood vessels. Now, the next thing that causes these blood vessels to injure specifically is stress hormones. And these are nasty chemicals released into the blood when you're all pumped up and wild. And these also break down the important Teflon lining. I say Teflon, but I mean, it's not Teflon, but just, again, keeping that image of this lining in the blood vessels, those stress hormones, they basically dissolve that. And so if you want to think of it, these stress hormones, they're like scraping a metal knife, right, across a Teflon-coated frying pan, if you can imagine that. It scratches the lining just like it tears and injures our blood vessels. But I think that really, among all these factors that contribute to damaging the blood vessels, the darkest threat is something called glyphosate. This is a broad-spectrum herbicide. It's widely used to kill weeds. And you know it under the brand name of Roundup. Now, you can go to PubMed.gov. You can read the studies yourself and decide if this chemical is a problem or not, because there's a lot of controversy. And there's some very creative science involved in this product. For example, studies show that it's harmless to human cells, but what they don't tell you is that it kills our microbiome bacteria. And so on it goes, right? And each person's going to have to make up their own mind as to whether or not glyphosates are dangerous. But just be aware that you're probably exposed to glyphosates not just in the food and the water you drink, but also from your pets and even your children. If they play outside in commercial parks and public areas that are maintained with weed killer, they're getting dosed. My father's little dog, Hannah, little white dog, she rolls around in the grass by his condo, and that grass looks like a putting green, right? And that dog has skin problems and also heart disease. Is it related? I don't know. But sometimes when I pick her up, I even get rashes on my arms. So I think there's a correlation. Okay, so if you noticed, nowhere on my list of things that injure the blood vessels did I mention cholesterol. That's because cholesterol is involved in the injury process, but not in its cause. So let's look at how the body heals these injuries and how cholesterol is used in that mechanism. This is really going to give you the final piece, I think, of the puzzle. So once this injury has occurred and the liver starts to shuttle the cholesterol, right, in LDL carriers to the injured site, and with that we get this massive release of anti-inflammatory agents that flood the system and they start to heal the damage. So think of the cholesterol as our first responders to the scene of the accident. Upon entering an area of injury, the LDL transverses the vessel's surface and it delivers its healing electrons. Now, ideally, this event resolves the problem and the cholesterol is returned to the liver by the HDL carriers where it's recycled. So in this role, we see cholesterol as an anti-inflammatory and as a healing agent, right? Which is great. But I mean, this is the ideal outcome. But if the injury is extensive and there's a lot of surface damage to the vessel wall, the immune system will get signaled to come in and to help clean up the mess. And I give a much more detailed explanation of how this happens in my videos on arthritis. But essentially, if the damage is not resolved quickly, these white blood cells, they end up staying too long, they age, and they become something called a foam cell. And I want you to keep that in mind, foam cell, because these foam cells are the problem. And they release inflammatory chemicals, which signal even more LDL, right, to the injury. And now this becomes a chronic inflammatory cycle. And worse yet, when these foam cells die, they explode. And they release all that toxic mess into surrounding healthy tissues, and the problem starts to spread. And this is the basis, my friends, of many chronic diseases, and it's what happens to an arthritic joint as it degenerates and it enlarges. So, as the blood vessel wall fills up with these foam cells, it starts to thicken, it becomes less effective as a blood vessel because a blood vessel needs to be flexible. So it is from this mechanism that we finally see the demonic plaque emerge. And this is how our arteries clog, right? Has nothing to do with a buildup of cholesterol. Has to do with these nasty foam cells. It's pretty gross, right? So look, now you know that cholesterol is actually our friend. I mean, it's just trying to do its job. And the big, bad immune system comes in, starts making these friggin' foam cells, right? And dropping all that plaque. So what the heck are we going to do? Right? Okay. First, let's stop the things that are damaging the blood vessels. So let's stop smoking. Let's stop drinking alcohol. Let's reduce our exposure to glyphosate, right? We can do this by buying organic food and being careful around commercial lawns. If you have an animal, like I mentioned, they're going to pick up these chemicals and transfer them to you, so you got to be careful. If you feel that you've been poisoned by glyphosate, then reach out to me. I'm going to recommend a protocol specific to help you remove this from your system. It has a nasty tendency to store in the fat cells of your body, and it's got to be eliminated carefully. So again, reach out if you have a problem with that. We can discuss that as a separate topic. But while we're talking a little bit about diet, don't worry about cholesterol. Like I said, it's not the enemy, but you need to worry about the chemicals in the food. And also something you need to worry about is the saturated fat content, right? Specifically, we're looking at saturated fats found in animal products. We know for sure these damage the blood vessels. Oh, now, some of you don't like that, do you? But look here, saturated fats contribute to these foam cells being made. In studies, we see it, and it only happens with saturated fats. It doesn't happen from animal sources, so not from plants. Saturated animal fats have lots of other negative health impacts associated with them, so just try to eat less. And if you're really serious about dropping that number quickly, then just take 30 days and eat a vegan diet, right? It'll work. It's going to drop the cholesterol numbers. Again, if you're serious and you want to see serious results, then I challenge you, cut out saturated animal fats for 30 days. And if you do, your numbers are going to drop like stones. By the way, that's what I did. And I'm including my exact diet in the show notes so you can review that later. And here's something else great, fiber, right? Fiber is a major player in helping to reduce saturated fat in your system. If you can get your fiber intake up, your health risk for cardiovascular disease is going to drop down. Get 20 or 30 grams of fiber a day. And this is why we hear things like oatmeal does the heart good and stuff like that. It's the fiber. It's all about the fiber. The fiber essentially shuttles the saturated fats through the digestive system so it doesn't get absorbed into the blood. That's what really it does. It's the fiber, right? Man, it's the fiber. Again, diet in the show notes for anyone that wants to follow me down that rabbit hole. Another big no surprise is exercise every day. And we need to get what's called phase 2 exercise, phase 2 cardio. So you can do this by going for a brisk walk and pushing yourself to a comfortable level where you can still carry on a conversation. This ends up being around 60% of your maximum heart rate. You can get that by taking your age minus 220, and then you take about 60% of that number. So me, I'm 54 years old, getting old, and I'm getting my heart rate up around 100, right? Around 100 beats a minute while I'm walking. Not difficult, and certainly not a marathon, but good for keeping my blood vessel injury down and subsequently keeping my cholesterol numbers low. And finally, right, reduce your stress. This is serious stuff. No, I mean, it's really serious. So get yourself a therapist, start meditating, do some breath work, go to church, whatever it takes, but do the work here. And if you need extra help, watch my other videos on stress. Take some valerian complex, which I find is excellent to help to retrain the nervous system so it knows how to deal with stress properly. I mean, since your entire body is controlled by the autonomic nervous system, then it's helpful to understand how that works and help regulate it with anti-stress techniques. Finally, what everyone wants, right? The supplements. So what I would do with these supplements is do 2 weeks, every day for 2 weeks, reassess. If the supplements seem to be compatible with you at that time, then continue the cycle for 2 months. And what we're going to take is mainly 2 supplements. The first one is called Garlic Forte, and it's a acid-resistant garlic supplement, right? And this is going to lower your blood lipids. It's been proven excellent for coronary artery disease, atherosclerosis, hypertension, peripheral circulation. As a side note, it's really good for your bowel flora because the garlic kills the bad bacteria in the bowels, but it leaves the good bacteria alone. Also, garlic, I use it extensively with people who have heavy metal poisoning and stuff like that. So it's a great product to take. 2 of these garlic tablets a day for 2 months has been shown to reduce LDL numbers by 18%. And that's just with that one supplement. So it does work. It works really good on these blood fats. The second product I'd ask you to take is called Livton Complex. You take 3 of those a day. By the way, take 2 garlic a day with food. This one you take 1 with each meal, 3 a day. And Livton Complex is a complex of herbs specific to the liver and to improving the liver's digestive capacity. So bile production, things like that. It's going to basically keep the liver clean, working at optimal efficiency, which is going to assist in the effectiveness of the liver producing the cholesterol, getting it out to the injury site and getting it back in time so it doesn't linger and create other problems in the body. Now, many of you are wondering about statins, and statins do work at lowering cholesterol. There's no question about this relationship. But statins do something else we'd rather avoid in our lives. They poison our mitochondria. These are the cellular components responsible for energy production in our bodies. This is why muscle pain is the number 1 side effect of taking a statin. This is why when people take statins, they feel like they've just run a marathon. Their muscles are aching, you know. Interestingly, even in patients with no muscle pain and normal muscle enzyme tests, biopsy studies have shown that everyone taking statins experience muscle damage, which is pretty scary. Statins can impede our energy production ability. They disrupt the pathway responsible for producing some of our sex hormones, because sex hormones are produced, as we mentioned before, by cholesterol, right? So when you limit the cholesterol production in the body, all those benefits and all those things I mentioned that cholesterol are used for, they get inhibited, and this sort of screws up the whole system. So this could lead to low hormone levels, such as progesterone and testosterone. Low testosterone levels are becoming increasingly common among older people, and it's probably because they are taking statins. And moreover, statins might elevate the risk of mild cognitive impairment or cognitive dysfunction. So statins are a real interesting topic and something that I need to emphasize. I'm not stating that statins are not suitable for some individuals. I think they're needed. What I'm suggesting is that you need to be informed about what questions to ask your doctor and what additional tests to undergo before considering any statin therapy. Make sure you familiarize yourself with your body, know your risk factors, understand your numbers, make informed decisions with your doctor. Regardless of whether or not you decide on statin therapy, you still need to reduce the things that are causing your liver to make all that extra cholesterol, which is the injured blood vessels, right? So it comes back to, why are my blood vessels getting injured, and really working hard to avoid that injury. Now, before we wrap up, I just want to talk a little bit about numbers. We talk a lot about lowering our cholesterol numbers, but then we're saying that the cholesterol is not the problem. It may be confusing, but it's very simple. Look, we can use cholesterol numbers as a metric, right, to indicate damage of the blood vessels. That's essentially what we're doing. And there are many detailed tests that you can do these days, such as you can get an NMR test. And yes, that's excellent because it'll give you extra information like the particle size of the cholesterol. But I want to keep things really simple. In fact, 20 years of being in practice, being a clinician, like I mentioned, and helping people prevent heart disease and stroke, I have never had a single person need to go beyond a simple LabCorp lipid panel. This only costs $15. And so here's what I want you to consider. Try to get your LDL number, right, below 100. Try to get your HDL number above 40. And I want you to try to get your triglyceride number under 100 and ideally under 75. Okay? That's simple. Then finally, I want you to divide your triglycerides by your HDL. And that number should be 2 or less. That ratio should be under 2. Right? So if your HDL number is below 40, that's too low. And then you need to increase your healthy fats in your diet, healthy fats from plant sources like avocados and things like that. But also, if your HDL is below 40, what I like to do is start patients on flaxseed oil. So I'll give them one of these flaxseed oil pearls to have with each meal. And I find that bumps up the HDL numbers very quickly. In a couple of weeks, it gets it up above 40 where it needs to be. Now, there's more to it, of course, right? I care about particle size. And by the way, if you want a deep dive on all this information on cholesterol with a lot of the references and facts, then just download the copy of my book on my website. It's free on cholesterol. And that gives you all of the nerdy information that you're going to like, including references. But for now, just focus on these numbers and commit to doing the things I mentioned, right? Now, I have an extra for you. If you stayed with me this long, let me share something personal with you. I'm always, as you may know, experimenting with my health. I'm trying to optimize and balance between performance and longevity. Unfortunately, my experience has been that longevity and performance are inverted. So as we do things to increase longevity, we decrease performance. And as we do things to boost performance, we have a tendency to decrease longevity. I wish it was different, but that's sort of has been my experience. So I spent a year eating a high protein, high fat, low carb diet to try and boost performance, right? I tried to boost the anabolic effect in my body to grow muscle and all that. And I was watching the guys doing the carnivore and I thought, I'm going to give it a shot. So I did that. And it did. It boosted testosterone. It boosted a couple of interesting things. And I did feel stronger. And I put on muscle as well. And I did lose some fat. But I also experienced some pretty threatening increases in my blood fats, right? So, for example, my LDL numbers went up to 160, which is just too high, right? Because I want to get that below 100. So I didn't like the profile in my blood fats. And so what I did was I decided to try to dramatically drop those numbers. I switched over to a vegan diet. And in about a month and a half, my LDL numbers went from 160 to 82, which I was very happy with, right? And I think that it really shows that there is the ability to control a lot of this, that we don't have to just sit back and feel victimized by our health. Again, if you follow this protocol I've given you, you should be able to get your fats, your blood fats, under control. You should be able to minimize, right? Not the cholesterol, but the arterial damage, the damage to the blood vessels. That's what we're after. And if you decrease the damage to the blood vessels and the threat of that, you're probably going to see your blood cholesterol panel numbers go down as well. Because you got to think, right? If you're pumping out total cholesterol numbers of, say, 400, well, then why is your liver producing that much cholesterol, right? It's doing it because there's a need. And so what's that need? Most of the times, it has to do with a lot of systemic blood vessel damage happening in your body, which is scary. We don't want that. We want to live a long time. And so please give this stuff some consideration. If you're interested in the products I mentioned, all the links are in the show notes. If you have any questions about this, just reach out to me directly. I'm available. And I hope this was informative. I hope you don't feel like I'm preaching too much. This is just my experience and the experience of my patients. This stuff I mentioned seems to work. I wish you a healthy, long, happy life. Thank you.